Good morning, friends. I'm Dr. Sachin Bhonsle from Fortis Hospital, Mulund. I'm a senior consultant, orthopedic and joint replacement surgeon. Today, we will talk about human shoulder and why it dislocates. Human is a two-legged animal. We don't walk on four legs, so our shoulder sockets are not very deep. They are quite shallow. Because of this, the shoulder has a tendency to dislocate, and once it dislocates again and again. That's because the socket is not deep like a hip joint, it's shallow. The shallow socket has got a lining, exactly like you have in the pressure cooker lid. There is a similar soft tissue lining that's known as a glenoid labrum. When the shoulder dislocates, the glenoid labrum from the front comes off. It gets ripped off, and that is known as a Bankart lesion. When the shoulder dislocates, the head of the humerus, which is the arm bone, comes in front, and the edge of the socket digs into the head. So you get a dent in the back of the humeral head. That is known as a heel sac lesion. These two lesions have been described quite a few decades ago. So when the shoulder dislocates, they develop a pouch in front of the shoulder in way of the Bankart lesion, and it keeps on dislocating again and again, and it is known as a recurrent dislocation of the shoulder. That can happen episodically. However, some patients get so bad, the Bankart lesion is so big that they just rotate the arm out and the shoulder pops out and then pop it back inside themselves, which is known as a habitual or voluntary dislocation of the shoulder. That typically happens in people who have got joint hyper-elasticity since birth. Typical example is gymnasts. They are born with joint hyper-elasticity. That's why they have a benefit of flexibility. However, they have tendency to dislocate their joints. So how do we go about it? When somebody dislocates the shoulder, I see them. I send them for an MRI scan of the shoulder with an injection of dye inside the shoulder. That tells me how big is the pouch in front of the shoulder and what I need to do about it. Typically, a couple of types of surgeries are available to correct a recurrent dislocation of the shoulder. It can only be corrected surgically. The most common and first type of surgery we do by putting a telescope, which is an arthroscope inside the joint. We put a couple of small screws known as anchors, and we stitch the glenoid labrum, which is the pressure cooker lining, back to the socket, and thus the pouch is obliterated and the shoulder never dislocates again. This is known as a Bankart repair surgery. Second type of surgery, sometimes the lesion is too difficult and it's difficult to do it with an arthroscope. So we do a small open cut, and under vision we do the Bankart repair. Sometimes this lesion is so big and then there is a bony defect. So we borrow the bone from next door, which is known as a Bristow latarjet procedure, where we add some bone to the worn out socket and do a shoulder stabilization surgery. Typically, when a shoulder stabilization surgery is done, the recovery period is 3 to 6 months. That is 6 months back to sports. Thank you.